Dear colleagues, welcome to the OncoAlert Roundup for April 4th to the 10th, 2025. These are just some of our picks. For a deeper look, we invite you to register for our newsletter at www.oncoalert360.com or through the links in this post. That's www.oncoalert360.com. Starting with breast cancer, prognostic implications of risk definitions from the monarchE and NATALEE trial. Patients in the concordant high-risk cohort from the monarchE and NATALEE trials had significantly poor disease-free survival and overall survival compared to those in the concordant low-risk cohort, emphasizing the impact of trial inclusion criteria on prognosis. Next trial is evaluating the impact of histological versus nuclear grading on CPS plus EG scores for hormone receptor positive HER2-negative early breast cancer. Using histological grading instead of nuclear grading in CPS plus EG score calculations may significantly underestimate risk in high-risk hormone receptor positive HER2-negative early breast cancer patients, underscoring the importance of prioritizing nuclear grading in clinical assessments. On April 2025, the FDA approved nivolumab plus ipilimumab and converted nivolumab monotherapy to full approval for MSI-H dMMR metastatic colorectal cancer patients. This is based on CheckMate 8HW, which showed significant improvements in progression-free survival and response rates. The next trial is circulating tumor DNA analysis guiding adjuvant therapy in stage 2 colon cancer, the DYNAMIC trial. The study's data support ctDNA-guided adjuvant chemotherapy for stage 2 colon cancer, demonstrated similar long-term survival outcomes as standard treatment while reducing chemotherapy use and providing better risk stratification based on ctDNA clearance. Moving on to GU cancer and out in the New England, assessment of polygenic risk score in screening for prostate cancer, Barcode 1. Prostate cancer screening program based on a polygenic risk score identified more clinically significant cases than traditional PSA or MRI screening, suggesting it could improve early detection and treatment targeting. Out on lung cancer, Neoadjuvant Aumolertinib for unresectable stage III EGFR-mutant non-small cell lung cancer. Neoadjuvant Aumolertinib demonstrated promising efficacy, a favorable surgical conversion rate, and manageable safety in unresectable stage III EGFR-mutant non-small cell lung cancer with evidence of immune microenvironment remodeling. And we end up with a paper out on Annals of Oncology, circulating tumor DNA clearance as a predictive biomarker of pathologic complete response in patients with solid tumors treated with neoadjuvant immune checkpoint inhibitors. This is a systematic review and meta-analysis. This showed that although lack of ctDNA clearance may indicate a low likelihood of pathological complete response after neoadjuvant immunotherapy, its limited specificity and high variability make it unreliable for guiding treatment decisions. And there you have it, folks, another weekly roundup. We look forward to seeing you next week.